Welcome back, dear viewers. So now we're beginning our first phone call interview, joined by Dr. Yusuf Shamsuddin, whom is a hospital pharmacist and is specialized in pharmacology. Dr. Yusuf, are you with us?
Yes, thank you very much for your invitation. Hi, Ronnie, how are you doing?
I'm doing wonderful, and I hope you're doing great yourself, staying safe against this pandemic.
Oh, well, I'm doing good. Thanks for asking.
That's great. Now, Doctor, we'd love to hear your opinion on whether the Society of Kuwait is fully aware of the serious side effects caused by COVID-19, because some individuals continue to have symptoms for months even after they've gotten better.
Yeah, as you said, to be honest, it's very challenging to be aware of all the complications of COVID-19. COVID-19 is a kind of a wide, it's associated with a wide spectrum of complications. But as you know, it's a kind of respiratory tract infection. So ideally, it starts with a common respiratory tract infection symptoms, sneezing, coughing, shortness of breath, and, kind of allergic symptoms. But for some cases where the condition itself is exacerbated and it's worsened, it may lead to further complications. Such as, GIT, gastrointestinal tract complications, such as developing diarrhea, for instance, loss of appetite, vomiting, and in even worse cases, especially with those who are hospitalized, that may lead to what's called an inflammation of the blood vessels, which is associated with an increased heart rate, and that may lead to what's called coagulation and the formation of blood clots. So ideally, it's not a kind of a single disease. It's kind of a disease that is associated with a wide spectrum of disease, and that brings us back to what's been circulated sometimes in the media, especially in the initial days, when they said it's just about a simple flu. It's not a simple flu at all. It's of different pathogen, different virus, different outcomes, and of course different severity compared to seasonal flu.
Right, and as you've mentioned, it can get quite dangerous.
Indeed.
Right, we need to stay protected, stay as safe as possible.
Indeed.
Right, now, Doctor, what about the newly mutated strain of COVID-19, otherwise known as COVID-20?
Yeah.
How is it different, and how would you comment on its dangers?
Well, based on the recent report, especially which was being published by CDC, there are three main variants being reported in the US. One of them is originated from UK. The other one is originated from Brazil. The third one is originated from South Africa. So all of these variants are characterized by the high transmissibility. So they spread faster than the wild type, which is the original one, which was being isolated from China. So what does that mean? Is those variants, they spread faster, so they increase the contraction and the infection rate in the society, and they increase the probability of people, especially vulnerable people, being infected, and that will increase the flow to the hospitals, and that will also be culminated by the increase in death toll, and that's what's been reported. We are all aware of what's happening in the UK, for instance, at the moment, and that's one of the main characteristics of the new variants is the high rate of spreading of these variants so far.
And when it comes to these mutated strains, Doctor, do the symptoms that come with it, are they stronger? Worse?
So far, it's, based on the literature being published, it's not more vicious, it's not more severe, but it's more, spreading faster. So it's again, just imagine, based on the reports, they said it's 50% spreading or higher in spreadability. So what does that mean? Is if we have a group of people being infected by the wild type, coronavirus, the new variants might spread more and might affect more than that number. So in that case, we have more people being infected, more people getting into the hospital, and increasing the chance and the probability of people being dead from the hospital. From the virus, sorry.
Especially as we further strain our medical system, that's not really something we want to achieve.
Oh yes, of course.
Exactly. Now, Doctor, as an expert, is there any way to tackle these mutations of the disease?
Well, I mean, it's typical kind of precautions, wearing masks and taking all the precautions, washing hands, and also social distancing. But more importantly, nowadays, what makes the things different compared to a year ago is, of course, vaccination. So if anyone has the chance to be vaccinated, he should not ignore or neglect this chance.
Especially those with other chronic conditions.
Yeah, especially, yes, of course.
Right. Well, in talking about the vaccine, doctor, by what percentage does it protect us from getting infected?
Well, the question is, I mean, if you, excuse me, to rephrase the question is about what's the efficacy, what's the effectiveness of this?
Is it?
Yes, so how effective are these vaccines? So we're talking mainly about three different vaccines, which are based on one technology. It's called mRNA technology. So these are three vaccines. One of them is from Moderna, an American company, and the other one is from Pfizer BioNTech, from American-German company, which is mainly now available in Kuwait and most of the Gulf states. And the third one is from Oxford AstraZeneca, which is mainly a British vaccine. So these three different vaccines, the difference between them is obtained by three main different factors. We're talking about the type of vaccine, the dose, and the age of the individuals. So when we talk about the type of vaccines, we're talking about the American vaccines like the Moderna and Pfizer. The carrier of the mRNA molecule is something called lipid nanoparticle. So this lipid nanoparticle is increasing the delivery and increasing the effectiveness of the delivery of the vaccine. And that's why these vaccines, for instance, they show up to 94-95% in terms of effectiveness.
Quite reassuring.
Yes. But on the other hand, we have the AstraZeneca vaccine, for instance, which is based on what's called adenovirus vector, adenovirus carrier. So it's a kind of virus body that's been inactivated and been weakened and then been filled with the mRNA molecule and then been injected into the body. So in order to deliver the vaccine, such a kind of vaccine the Oxford AstraZeneca vaccine showed up to 90%. So it's not more than 90%. In terms of effectiveness. That's based on the type of vaccine. But going back to the second factor, which is the dose. So we're talking about most of the vaccines available nowadays. They are taken and being administered by the regimen of 2 doses. So the first dose is called a prime dose. So and after that, by 3-4 weeks roughly, the individual is receiving the other one. Is called a boost dose. Okay.
So similar to what happens with pets.
So after the prime, after the prime dose, after the first dose, by 7 to 10 days, the immune system starts to generate the antibodies, and then after that, after the first dose, the immune system, the effectiveness of the vaccine is roughly from 50 to 80%, I would say, and then after that, once the individual is receiving the second dose, which is the boost dose, that will boost the effectiveness of the vaccine up to 95-94%. Now going back to the AstraZeneca Oxford, it's still less. After the second dose, it's still not more than 90%. The third factor, which is the most important factor, is the age. So we're talking about Pfizer, for instance. For Pfizer BioNTech, it showed a stability in terms of effectiveness regardless of the age range. So people who are more than 75%, they showed roughly 100% effectiveness and protection. People around 55, they are showing 93-94. But, when it goes back to Moderna, for instance, those who are older than 65, they showed approximately 86% protection based on the phase 3 study results. But according to Oxford AstraZeneca, nothing has been published regarding this kind of old individuals, but it's expected to be less effective and in older ages, to be honest.
And how about the efficacy in younger individuals in their 20s, 30s?
In the younger individuals, for instance, the Moderna and the Pfizer vaccines, they showed 95-94% in terms of effectiveness, and quite high, of course. And of course, the AstraZeneca Oxford is showing around 90% in terms of effectiveness.
All right, sounds great. You wouldn't imagine that there's a difference in efficacy when it comes to age. So it's great that you've highlighted that.
To be honest, surprisingly saying, is when I read the studies of the being published from phase 3 studies, it's not only the age, but sometimes also the gender difference, to be honest. Yeah, and it's not only about the effectiveness. Sometimes it's also because of the side effects of the vaccine. I witness it sometimes. Females experience a bit more side effects than male individuals, to be honest. But it's not been proven or been fully covered or published, to be honest.
Okay.
But
and what are the side effects, doctor?
So the side effects is it's typical kind of side effects being reported by vaccines. We are talking about it's a wide range of side effects. So the side effects, first of all, they are classified into 4 different groups. We're talking about mild, moderate, severe, and critical. Thanks God there is no critical side effects so far. But we're talking about, as you said, the most common side effects are headache, fatigue, and that's mainly in about 50 to 60% of the individuals they experience after the first dose. But these side effects are getting a bit harsh, a bit more, is a bit tougher, I would say, and stronger side effects after the second dose. So people who experience, for instance, fever after after the first dose, they would experience another episode of fever after the second dose, which might be even a bit harsh or more severe, to be honest, compared to the first one. But most of these side effects are manageable at home. Taking painkillers, keeping hydrated, and taking rest, and if possible, taking a sick leave should be fair enough to control the side effects.
All right, perfect, doctor. Now, is the vaccine also effective against the mutated strains, COVID-20?
Well, this is a very good and challenging question, to be honest, and it needs a kind of it needs to be clarified. Okay, first of all, the 2 variants, the 3 variants being reported, 2 of them being studied by the vaccine companies. So the one from the UK, the other one from the South Africa, and recent reports being published from Moderna and Pfizer, they clearly showed that their vaccine is still working, is still effective against these variants from the UK and from the South Africa. Now, people they are arguing how come the same vaccine being effective against the original and the variant? Now, if we want to simplify the idea of being vaccinated, okay? So so what's the main aim of vaccine? The vaccine itself, once it's injected into your body, what it does is it programs it precondition your immune system to identify the virus once the virus is getting into your body, okay? So what is the part of the virus being targeted by the immune system? A part is called spike protein. So now going back to what is the spike protein? So it's a kind of protein located on the surface of the virus, and it acts as a key to the virus. So ideally, it's the mediator, it's the attachment point of the virus to the victim cell as a starting point of getting for getting into the cell, replicating inside, and causing COVID. Okay. So the vaccines, they program the immune system to target the virus on that point, on what's called the spike protein. Now, taking an example, if we want to simplify the idea again, is if we let's imagine that our hand is the virus, okay? Sorry, our arm is the virus, and the hand itself is the spike protein, okay? So in our hand we have 5 fingers. And these fingers are considered as the attachment point of the virus to the victim cell, okay? So the first scenario here is you want to program the immune system to target the virus, to target the virus on these 5 points, yes? In order to inhibit the attachment of the virus and then in preventing COVID, okay?
Right.
Okay, now the first scenario, if the variant carries the mutation in somewhere other than these 5 points, then there is no effect of the variant on the efficacy of the vaccine, because still the vaccine is programming the immune system to target the 5 fingers, and these 5 fingers nothing has changed. But the second scenario is if there is a change, if there's a mutation in one point of these attachment points, we still have a reservoir of 4 different points being still targeted. Yes.
Right.
And that makes the vaccine more efficacious. Still efficacious. More importantly, let's say after a year, 3, 5 years, different mutations may happen, and all of these points being mutated. what will happen? Nothing extra. The companies will develop a new vaccine, which is directly effective against this new variant, and it will not take more than a few days, because these companies has their own protocol being established. Everything has been established, so they can treat it as if they're treating now a seasonal flu vaccine, to be honest.
Right. We have developed vaccines quite fast, relatively, which is great, and hopefully we can achieve herd immunity sooner than later, so that we can go back to our normal lives.
Oh, indeed.
Now, doctor, let's talk about the PCR test and just its accuracy, because some individuals have had the result come back with not a positive or a negative, but an unclear result that requires retesting. So just tell us how accurate the test is.
Well, of course. I mean, the PCR itself, the test is based on so the PCR it stands for polymerase chain reaction. So it's a kind of reaction that targets a specific site of the nucleic acid of the virus. So it's very selective to the virus. Okay. So now there should be a kind of level of virus that should exist in the body in order to be triggered significantly by the test. So that's why, for instance, if someone has been contracted the virus, and if he goes to a PCR test,
won't show up.
More likely he's going to be tested false negative, because the virus hasn't been replicated in a proper amount to be recorded or to be recorded by the PCR. That's why they are asking the individual to wait for 3-5 days in order to do so. The virus, if there is a virus, after the incubation period, the virus is going to be replicated, and after that can be easily recorded by the PCR. More importantly nowadays, people, they think that the PCR or the vaccine might give a false positive result for PCR, and that's not true at all, because currently the vaccines being in the market, being available, they don't carry a live virus, so there's no virus being introduced into.
Inactive.
It's not. I mean, even the viruses, for instance, the Moderna, the Pfizer, and the Oxford AstraZeneca, there is no virus being. There's no coronavirus being injected into the body. It's a part of the virus. It's the nucleic acid which will not be replicated in the body. Right. So once the nucleic acid being injected into the body will read that nucleic acid, and then the nucleic acid is done, is disappearing from the body, so there will not be replication, and it will never give you any kind of false positive in the PCR.
All right. Thank you for clarifying that, doctor.
Oh, you're welcome.
Now, if individuals do get vaccinated, would they still need to get a PCR test done? Because the way I understand it is they may still get the virus and infect others, but not show symptoms.
We go back to the same idea of what's the aim of the vaccine. Okay, so the aim of the vaccine, as we stated, is programming the immune system to target the virus directly in a short period of time. Okay. Now, what does that mean? Is if I'm, as a vaccinated person, I just sat with someone who has been, a carrier of the virus might get into my body, but the immune system is going to respond promptly, and that will, demolish the virus within 72 hours. Let's say, based on the literature being published. So if I go to the PCR clinic within the 72 hours, I might be tested positive because I contracted the virus. But more importantly here is I'm not going to show any kind of symptoms of this disease, because the disease is very mild, and the likelihood of transmitting the disease is very minimal, because the virus is not going to find the incubation environment which is suitable for it in order to be replicated into my body. So once it gets into my body is going to target it, and it's going to be demolished. Okay. So the likelihood of me transmitting the virus is much lower, almost impossible and negligible, compared to the one who is not vaccinated. Because the ones who is not vaccinated is, of course, providing a good environment for the virus to be replicated and to show symptoms like coughing and sneezing, and that's where the virus is transmitted from person to person.
Right, and we're urging everyone, of course, to go get vaccinated.
Oh, of course.
It's a social responsibility that we all have towards getting better.
Oh, yes.
Well, doctor, we really thank you for joining us this evening, and we hope to have you back soon.
Oh, you're welcome.
Thank you. So, dear viewers, with that we were speaking to Dr. Yusuf Shamsuddin, whom is a hospital pharmacist and is specialized in pharmacology. And just as a reminder, we'd like to highlight that as you're being vaccinated and after getting vaccinated, please continue to wear your medical masks and maintain social distancing to continue keeping yourself and others safe. Now we go to a report on home care for suspected and mild cases of COVID-19. Stay tuned for more after that.